One, it's another day with your fertility specialist. On behalf of Alps Hospitals, I love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. I'm your host for today's session, Ruth Ogogo, and I really do hope that you have a good time with us today. We'll be talking about life experiences of people that have gone through um fertility, that had they had their own fair share of fertility issues, and how they were able to pull through and achieve success. This is to encourage someone, this is to make someone very much enlightened, just in case you don't have so much knowledge about some issues you're dealing with. This is also to raise hope for someone, raise a rim of hope, make you know that there's still light somewhere at the end of the tunnel. And it's just to help you know that no matter what it is you're going through, there's definitely a way out. And to share this life experience with us today, we have Dr. Deborah Ulubi. It's good to have you, Dr. Deborah.
Thank you, Ruth. It's always a pleasure to be here. Good afternoon, viewers.
So, viewers, as we get started, a little about Dr. Debbie for the sake of someone joining for the first time. She's a family physician, she's a fertility specialist, she's an IVF specialist, and she's also the IVF coordinator at Alps Hospital. And we know that the pathway to motherhood is long,
Mm.
and it's not it's not an easy one. As much as people get pregnant, eventually when they are pregnant, and then they're like, oh my god, this is a lot, this is more than I thought.
And
And
that's
like, oh
another
god,
phase too after the child is
yes,
born.
yes, as much as it's exciting, very overwhelming, but it's most women's dream to actually
Yeah,
see that they're able to experience motherhood.
good.
I mean,
Yeah.
carry their children, nurse their babies. So today would share a remarkable story of favor, a woman who found hope again after years of infertility. She had, if well, she didn't mention how long she had, but she said um, for several years, she and her husband had tried to conceive naturally. I mean, I know she's trying to say spontaneous.
Yeah.
They've been trying the other way. It makes me want to ask this same question that we ask a lot of times. Do you think people should try? Because if she's seen for several years, she and her
Mm.
husband had tried and all of
Yeah.
that, but I can imagine how long they have tried before. I think people should actually stay seeking help.
Okay. So it's tied to age. The younger the one, you can stay longer. So if a woman below 35 years of age
Okay.
and for a year, you should seek help. And if a woman is older than that, after trying for about 6 months, you seek help. Some women, as they're going into marriage or beginning to a baby, they already know some of the issues they
They
have. So
have
they might not even need to wait at
at
all. You already
all.
know you have
Hmm.
some challenges with fertility already. So there's
Hmm.
no issues are there already. Just get help immediately. But that's about it. If you're less than 35 years of age, you can afford to travel a year. But if you're
Hmm.
more than that, 6 months or less, you should
Okay.
get help here.
Sometimes you hear people say that before they eventually end up doing IVF, you hear them
Yes,
saying, we went for check after we had tried, and they said everything was
it's
fine,
normal.
and
Yeah.
then trying
And
again
again,
and wait.
yeah,
And I mean, even if you feel like about a year, you're a young person, and then
yeah,
you
yeah,
seek help and they tell you everything is fine. I don't think back for so long
exactly.
when you are still not as
Fine.
fine.
Yes.
You should be able to seek for even if you're saying everything is
It's
fine,
fine.
can we just
Something.
do, I mean,
Yes.
let's just do
Yes.
something
Yes.
different. You
And then
stay back.
go and stay for years again,
Yes.
and then other issues will set in.
Mm,
Yeah, there are different kinds of fertility treatment. Mustn't be IVF. That's the
yeah.
mistake a lot of people make. Different kinds of fertility treatment. So it mustn't be IVF. IVF is
Mm,
like the bus stop, final bus stop.
yeah.
Into for me, yeah, let me use that line. But there are
Yes.
different things that could be tried. Some women might, because they're not ovulating,
Mm,
not that they don't have eggs, but they're not ovulating, and then simply to give to with that, and then she
yeah.
can for you to go for evaluation, and you're told nothing is, and then you go back
Yes.
to the same thing, nothing new
Exactly. No.
or differently is being done. I don't think that is okay.
Then some of them will start consuming options and all of that.
Exactly.
Things from here,
Then
doing self
causing other
medications and
exactly
all of that.
damage to the body and organs. Yes.
So okay, so she said that each month began in heartbreak. I mean, I know
Mm.
for someone trying, she will always be heartbroken when she sees her
That
period
period.
again because
Yes.
she's like, I was just turned out to be
Yeah.
pregnancy. So she said when they finally decided to seek medical, the test revealed a difficult challenge. That her lining was thin and not responding to standard medication. Apparently, maybe at some point they had given some medications, and so they went to find out. The doctor
Yeah.
had told her, "Play. Maybe you should tell us a bit of what the lining." Because for a woman that is saying lining is thin,
Hmm.
what role does the lining really play, and what is the best state that we could actually achieve pregnancy with for
Wait.
a
Okay.
lining?
So endometrium is that's the inner lining of the womb,
Mm,
and that's where implantation or pregnancy happens.
okay.
Yes, the tissue in that lining has to be healthy for
Okay.
implantation to happen, and it should be of a certain thickness,
Oh,
usually
okay.
up to about 12 millimeters. So if they're telling her it's thin, that means it's less than
Then
7 millimeters.
seven.
That
Wow.
kind of thickness and it does not favor implantation.
Station.
Yeah,
Wow.
and there are lots of things that could lead to a lining being thin. A
Hmm.
lot of pathologies,
Okay.
problems that could lead to the lining being thin. Yes, so
To lose hope because it was more like telling her where the baby is supposed to stay is not looking good.
good,
So she
exactly.
she felt this one is more like if this is not happening, it means there's no hope. She said
Yeah.
she began to lose hope, and then a close friend of her referred her to Alps Hospital. A close friend of hers referred her to Alps hospitals. Okay, that's more like her saying no for its innovative approach to reproductive medicine. Because yes, at Alps Hospital you have a lot of risk technologies
Yes, that
that
are
are being
available that you can
available.
avail
Yes,
yourself
exactly.
of.
That are very accessible at the
Yes.
hospital, both universal, some global technologies you could actually access them at Alps Hospital. So that's what she was just
And
trying
we're
to
the
say.
pioneers of a lot of the technologies,
Mm,
we are the ones that started them, especially in
wow.
this part of the country.
Wow.
Yeah.
So you see, so that's all that it's even if she experienced it and she knew, but from her experience she had this, even though they told her
Yes.
something wrong with the lining, but she wasn't getting solution
Sure. Yeah.
apparently until her friend had referred her here. So she said the doctor had history, and then yes, at that point she said they recommended hysteroscopy. I think apparently they could see what they probably also want to find out what was happening or what was
Exactly.
responsible
Yeah.
for it.
Because
Um,
a stereoscope will allow you to directly visualize. So
mm,
when there are problems, the pathologies, adhesion, scar tissue, masses, fibroids, polyps, all those abnormalities that would not favor implantation, that can be seen at hysteroscopy them. So it's not just diagnostic. You're making a diagnosis, and at the same sitting, you're treating whatever it
okay.
is. Yes.
Okay, so maybe we should digress a little. A lot of women do things that could actually be detrimental to the inner lining in
Yeah.
their young age. Some
Yeah.
of the things that you think ladies could actually do that could actually endanger the lining of the womb or no to them until maybe
Yeah.
later on they now start issues.
Yeah, you're right. A lot of things could damage the lining of the womb, leading to scarring or scar
Mm.
tissue forming. One of the presentation of this will be that thin lining that you see on a
Yeah.
scan, or a lining that is resistant to the normal standard hormonal drugs that we use. So women that have had, multiple D&Cs, evacuations,
Mm.
from unwanted pregnancies, so on. That process damages the line when it's not personnel. So women that are also of pelvic inflammatory disease,
Mm.
infection in the womb, the lining of the womb, damages the lining.
Wow.
Still, people with chronic endometritis, that damages the womb. So
Oh,
those are some of
a
the major
lot.
things that could damage the womb. And then people that have had all forms of instrumentation,
Mm.
from whatever cause, even people, myomectomies, fibroid surgery, yes,
Yes.
even if so much care is not taken, and sometimes
Taking
it's inevitable to remove the fibroids,
just
lining is
temper with
damaged,
it.
yes. Those things could damage the lining of the womb.
So, dear viewers, thank God. So, Debbie has actually mentioned a lot about what could damage the lining of the womb. So, this is to let a woman things that you do now, or some of the things that you over now, could actually be detrimental to your fertility
It's
prospects in
yeah,
the
the
future.
future. Yeah.
And that you don't just live anyhow. You
Mm.
have to, if you have the, if you really children, then you should be very mindful from now how you
Your
actually now.
lifestyle.
Yes, exactly, your lifestyle. That's the word. You don't go out doing all sorts of terminations of pregnancy, and then later on it now
Mm.
becomes an issue,
Yeah.
or in fact you just turn a blind eye to infections, and then they ascend and cause some issues for you. Please, let's all, yes, for parents, be mindful for your children, so that victims of this in future, as well as that's why sometimes even for surgeries you don't just go to anyhow place. You have to go to a place. Yes, sometimes I know these things be table,
Mm.
but it's that you go to where you're sure have very good professional and capable people that, that will just do a gamble or do it anyhow without any regard of respect.
You
Because
know,
some, they're just
yes,
after taking off the
fibroid,
fibroid,
that
don't
the end is that you
care.
want to get. That's why these
Pregnant,
fibroids are being
exactly.
removed.
And then
Yes, so the fibers are taken out, and is totally damaged.
yeah,
So that has not helped to advance. Her dream of
exactly.
having her own baby. Yeah,
Mm,
so skilled personnel to
personnel.
perform is very
Mm.
important.
So she said she had to have a second look hysteroscopy even after the first
Okay.
hysteroscopy. So by the second hysteroscopy, the outline of the endometrium looked better than what was from the first hysteroscopy. The doctor had also recommended endometrial rejuvenation for her
Mm.
using according to how she was told because of her second hysteroscopy. So she said that that was the game changer for her.
Mm.
So she said, well, she talked about how the doctor explained the procedure, because of course, that's one good thing of when you have a good understanding procedure you are doing,
Yeah.
how it helps you.
The theta,
Exactly,
and
I
you don't
don't
know
know
what
what
was
is
done.
even for you
Yeah, because
exactly.
you need to give an informed consent. When you're on the, you should actually know what is done for you.
Mm.
Yes, you should
Someone
actually.
might also be wondering what endometrial review actually is.
Okay.
Maybe you should tell us a bit about it, and maybe procedure is done, so that people have a little idea and not just
About it.
wonder.
Okay.
Yes.
So endometrial rejuvenation is just a process to try to repair a damaged endometrium. She mentioned PRP. Yes, PRP is platelet-rich plasma. So it's the blood
Okay.
that is taken, and then
Mm.
blood is separated, centrifuge
Oh,
separated.
okay.
Plasma part, the platelet-rich plasma part is gotten, and
Oh,
this is what we inject or infuse lining. And what this does is that it stimulates new
oh,
cell
oh, wow.
proliferation of new cells,
Okay.
reactivation of new cells, endometrial tissue. This
Mm,
PRP also stimulates new blood vessels to be formed,
mm,
improves blood flow. When there's adequate blood
wow.
flow, tissue
Mm,
can grow,
yes.
improves flow, and it has also been shown to improve the receptivity of the endometrium to embryos for
Wow.
implantation to
Mm,
take place. So that's just what we try to do with endometrial
okay.
rejuvenation. We're trying to cause the development, formation of new cells, to grow over the damaged tissue. Healthy endometrium can grow. So that's what PRP does. In stem cells, so you get stem cells from the bone, and this is also used, to try to cause the regeneration of this new tissue. So it can either be injected. So this PRP